Hi, everyone. Good morning. This is Joan from the Exchange. We appreciate you being with us today to talk about our 2021 legislative priorities. I have a few technical housekeeping notes to cover at the top here. First, you should be seeing on screen right now the participants who are joining us today from the Exchange, and we really appreciate the interest in this topic and appreciate that with the current environment we're in, there's a lot of interest and curiosity about how the Exchange, how our state agency partners, how we're all working with the governor's office and interested legislators to move through what's going to be a bit of an unprecedented session for lots of reasons with COVID and the virtual environment and our funding situation as a state. So today we're hoping to engage. We have a bit of a technical glitch where the Q&A feature is not working this morning. Mary McHale has graciously agreed to let you all email them your questions and comments throughout the webinar this morning, and they'll be monitoring them and will be able to respond in real time by introducing your questions and having us address them on this call. So again, we apologize for that. I love technology. It's 2020, it's almost over. So to the extent you have questions or comments or things you'd like us to either address today or follow up with you afterwards, feel free to contact Mary, and their contact information is up on screen. I'm also joined today by Nick Asaby, who will be talking in some detail about our budget. Evan Klein, who can answer questions about Cascade Care and our subsidy study and other sort of main policy areas we're working with legislators on heading into this session. And Carly is our administrator who is making this whole webinar go, and we will all owe her gifts after this. So we'll go ahead and move into today's topics. So first, I'm just going to touch on, I get a lot of questions from some of you on this call included about what we've been up to over the interim. So we'll be talking a little bit about what we've been doing. That's obviously a lot of COVID work. It's been a lot of preparing for open enrollment. We are currently in open enrollment. We're hoping you all have gotten your coverage and checked out our new plan offerings and are helping the people you work with take advantage of the time period between now and January 15th. We also have some legislative deliverables that we've been working on over session. We'll talk about those, and then we'll move into what we're working on heading up to January. So first, just a look at our interim activity. There has been a lot of work going on in the COVID space across agencies in concert with the governor's office, in concert with the various legislative work groups that have been set up to implement kind of emergency rulemaking and guidance and respond to the federal activity in this area. Access to health insurance is obviously a key part of this state's pandemic response. Access to testing, access to care are crucial. Sort of coverage is a key determinant of health, one of many, one that we have been working primarily on. We obviously at the Exchange run Health Plan Finder. Health Plan Finder connects people to Washington Apple Health and the individual market. We've seen over 100,000 new Medicaid enrollees come through Health Plan Finder since the pandemic began. We've also seen tens of thousands of QHP enrollees come through. The individual market is the market that people who lose their employer coverage and need health coverage or want health coverage rely on. So we already have a pretty seasonal, volatile population, and we've seen a huge influx of people as they've been particularly becoming newly unemployed come in and work with us and look at the options available to them. I'll note we know affordability is still a barrier in the space, and we'll be talking about that a little bit further on, but we've been doing a lot of outreach in this area. We've also seen the uninsured rate increase, particularly among the newly unemployed. The Office of Financial Management does some amazing modeling and projections in this space. If you haven't seen them, they're on their website. They note among the newly unemployed, the uninsured rate has gone from 10% to 40%, which is sort of a staggering number when you think about the over 1 million unemployment claims that have been filed since the pandemic began. We work pretty closely with them. Both the Exchange and Healthcare Authority send data to OFM, who also pulls data down from ESD to inform that modeling work, and that's something we've done at a weekly basis since the pandemic began. We have our health equity TAC. They've been very engaged in our response. We know that Black, Indigenous people of color are being disproportionately impacted. We know that they were disproportionately part of the uninsured to begin with before the pandemic, and we've seen that exacerbated since. Minority-owned businesses and minority employment is highest in the sectors that are being hit hardest by COVID. So what did we do? What among the things we've done? We've obviously worked to implement emergency rulemaking and done a lot of operational things in this space. One of the most significant we were the first exchange in the country to open a special enrollment period for the uninsured. We coupled both a community engagement outreach effort with putting resources toward targeted marketing. And we saw that made a significant difference. First, just looking at who we were able to reach during the pandemic as opposed to during a typical open enrollment period. Most of the people we saw notably were new to the exchange, meaning that they hadn't had coverage with us. 75% versus the 19% new we typically see during open enrollment. That's a huge difference. And that's where we really see this newly unemployed population coming to play. Most of the people we reached, or more of them, were under 35, over a third, which is not a barrier that we typically break. And they were more racially diverse. Over a quarter of the people we reached were people of color. What have we been doing since the special enrollment period? We have ongoing special enrollment periods that occur throughout the year outside of the open enrollment period. These are for people who lose their coverage or experience a change in income or a change in their household or have some other type of qualifying event. There's typically a 60-day enrollment deadline from that event for you to sign up. We extended that deadline for those losing their coverage during the pandemic. We saw a gap between when people sort of reported their loss of employer coverage and whether or not they were able to sign up. We know part of that was an affordability barrier, but we also know part of that was people waiting to get their checks from ESD. So we extended that to allow time for people to file for unemployment, have their unemployment claim, get that claim, and then they were able to come in and get insurance. So we did see an uptick once we did that. I mentioned that we've been looking at the newly unemployed. This is a group that Mary and I, we just laugh. We've been on a road show, it feels, of sorts for several months now, working with everybody from, Boeing, Port of Seattle, working with everybody in sort of the airline industry who's being impacted. That's from the airlines themselves all the way down to the people who, might have a bodega that you see in SeaTac. We've been pretty active in the childcare space. I'll speak a little bit more about that, but we know that childcare workers are sort of in harm's way as it relates to COVID and also face significant affordability barriers and language barriers to the exchange. So I've been doing some work with associations and advocacy groups in that space. A lot of talking to human resources departments from different employers, Nordstrom, others. We want to be in the same conversation as COBRA. COBRA can be prohibitively expensive for people. It's temporary. And also if you go out of business, COBRA goes out of business with you. So there's been a lot of interest in how our products compare to COBRA, and we've been giving a lot of presentations to sort of let people know that, first of all, we're an alternative to COBRA. Second of all, if you choose your COBRA coverage and it's going away, that's a special enrollment period where you can come in and get coverage on the exchange. We've also been working pretty closely with the Employment Security Department. We've been creating materials and collateral and buttons and links and things for them so that when they're communicating with customers about their unemployment benefits, there's a handoff to us to work with them to get coverage and review their coverage options. That's something that we're looking to strengthen, and we'll talk a little bit about that later. We sort of have been working primarily with our communications department and others to make sure that there's some linkage there. We've also had our lead organizations, our navigator teams, coordinating closely with the local rapid response teams. So we've been working with labor and other groups as well to sort of make sure that we're connected to the efforts that those groups are doing to reach people who are newly unemployed. Another area that we've been focusing on, because we have so many new people to our market, we know people are just going into Google and saying like healthcare or health plan finder or exchange and Washington. And there are deceptive ads, and there have been some lookalike websites that have cropped up to try to take advantage of people who are looking for insurance and maybe unfamiliar with the exchange market. So we've been doing some work with the Attorney General's office and with the Insurance Commissioner to try to crack down on these lookalike sites. Most recently, there was a court order issued by the Attorney General's office to sort of a cease and desist order to make one of those websites that was getting several hits and then calling people and kind of harassing them about signing up for coverage, not necessarily in exchange products either. So that's been resolved, and we're going to continue our partnership with them to work in that space, and also have sort of in a related area, we've seen both increases in scams and increases in cyber attacks. So we're sort of working with the AG and OIC on the scams fraud component, and then working with our security team on the increase in cyber attacks, and we have a bit of a cybersecurity package that we put together to address that as well. I hate that I can't talk to you all. I hope, Mary, to the extent there are questions or exchange staff, if you want to seed any to me as we're going, please feel free to do that. I'll sort of pause and take a quick look to see if we have any, and I'll sort of soldier on here. In addition to everything I just shared, we've been preparing for open enrollment. It's obviously a very different environment for us this go around. We've been focused on working with our brokers and our call center and our lead orgs to find new ways to connect people with assistance. Again, we have a statewide assister network that helps people. It's navigators, it's community assistance counselors, it's tribal assisters, it's certified producers, and it's enrollment centers. So again, if you work with anybody who needs help stepping through their insurance options, if you want me and Mary to come give you a presentation, present to any audience, we've been in front of everybody over the past 6 months, and we think it's really important, and we want to do as many of these outreach events as we can. So we can connect you to navigators. We've been connecting people to local community assistants who can help them in a bunch of different population specific settings. And so to the extent that there are groups that need to hear from us and or that could benefit from being connected with a local resource, definitely let us know. We're trying some new things this season. We're looking at drive-through outreach and enrollment assistance and other sort of social distancing measures that have been put in place to allow people to have an in-person experience if that's something they need or want. Another thing that you may have heard about is that we launched Cascade Care. This has been getting a lot of statewide and national attention. We're the first state in the country to implement a public option program. We've been working with the Biden transition team and others for a few months now on as they've sort of formed a national strategy in this area. We think it's obviously critical to be removing barriers to people who are seeking care right now. There also will be real implications for people once a vaccine's developed in terms of how they seek and receive the vaccine. So continuing to engage there. Our new Cascade Care plans do provide more value. There are two types of plans. There's the Cascade plans, which some of you may know as standard plans. They have a standard benefit design package. And then there's the Cascade Select plans, which are the public option plans. Cascade plans are available in every county. Cascade Select plans are available in 19 counties. Cascade Care plans were required of carriers. Cascade Select plans were voluntary. So you see some difference there in the availability of those products. Both types of products provide meaningful deductible increases. We heard from customers they weren't feeling like there was a value in the coverage that they were purchasing because the deductibles and the cost sharing were so high. So we designed a product in in working with carriers and others to bring those cost sharing costs down and to put more services before the deductible. So those are your primary care visits, your mental health services, your generic drugs, things that are people utilize more often to try to move up so they can continue to access those services. We heard from our customers that we surveyed who told us that 40% of them were skipping doctor's appointments and skipping tests because of concerns about cost, and that was something we knew we had to address. So how will people know which of these what our Cascade Care products are? We have a lot of plans in our market this year, and we really want to make sure customers are aware of the new products. You can kind of see on the right, there's the Cascade Care logo that will show up next to the plans that are Cascade plans. This map shows you the 19 where the Cascade Care Select or the public option plans are offered. It also shows you that statewide we have an increased sort of carrier participation. In every county, everybody has a choice of 2 or more issuers. And you can see that by the different colors that are sort of across the state there, all the way up to 9 in Pierce. So in addition to sort of our COVID response and the Cascade Care launch and preparing for open enrollment, there are a handful of other activities and conversations that we've been engaged in. As part of the COVID response, there's a lot of ongoing federal uncertainty there about when the public health emergency will end and what that means for some of the rules and regulations that have been put in place during that time. So we're coordinating closely with partners at DOH and HCA and OIC around how and what types of transitions need to occur when the public health emergency ends, and then also how that might roll into legislative session where people are working on extending some of the flexibility that's been granted during the emergency. There's also obviously ongoing conversations about public health and public health financing that we've been participating in. There's various legislative work groups focused on reopening the economy that we're participating in as well. From the affordability perspective, this is the barrier that we're hearing the most about. We're working on affordability in a couple of different ways. First is working on development and enhancement of our sponsorship program. We have a program not many people know about our sponsorship program. This is another area we've been doing a lot of outreach and education on throughout the pandemic. We have a program that allows that sort of statutory authority was granted to the exchange to work with private funders, counties, cities, states, foundations, trusts, public payers, private payers, people who want to help segments of the exchange population afford their health care. We work with them to do that, and they can wrap around the federal subsidies you get through the exchange to help lower premiums for people. We work with partners at Department of Health and Evergreen Health Insurance Program. We work at 2 project access programs across the state. We work with 10 or so tribes who pay premiums on behalf of their members. We work with the COFA population and where Healthcare Authority wraps around both their premiums and their cost sharing. So this is a program that's existed since we launched the exchange. It's consistently grown every year. We have limited staff resources to support it. We have limited system functionality to support it. But again, in seeing the need and responding to the requests that have been made over this past year, we feel like that's an area where we can grow and enhance our ability to support that program so we can more immediately help people who need immediate relief. We're also working on a state premium subsidy program. We have a report that's due to the legislature at the end of this week, which is a little bit frightening, but where as part of that plan, it's sort of we were tasked with how could the state offer a premium subsidy program? What would it cost? What are some ways you could pay for it? There's obviously a lot of discussion, a lot of financing discussions going on. From an exchange perspective, there's a way, if folks find the money to make a subsidy program happen from $200 million all the way down to whatever the state can afford or whatever the state's committed to moving forward, we can apply it and make it happen and have it so that people see some premium relief, which we think would be great. There's also a lot of interest in population-specific subsidies, whether you're doing it through a sponsorship program or you're doing it through a state program. Childcare workers, again, is a population that we've been working with: essential health workers, low-wage workers, low-income populations, the newly unemployed. They're all populations that different legislators have expressed interest in helping, and so we're working with them to come up with what some potential cost estimates would be of covering different segments of the population where there's different levels of legislative interest. I mentioned our legislative reports. For anyone who's interested, every year the exchange sort of identifies strategic priorities and submits an annual plan. We're statutorily required to submit sort of a strategic plan updates to the legislature every year. That's on our website. We publish it. We submit it in September of every year. That then informs our budget. We then put all our budget and decision packages up online, so we have a pretty transparent process for folks who are interested in terms of identifying our priorities and then putting up our budget that sort of aligns with those priorities. This year, we also have the state premium subsidy that's due, and then an individual mandate study that's due as well. That's Senator Cleveland's run her individual mandate bill for a few years now, and there was a proviso included in the budget last year to have us look at that. So we shall. Other legislative work groups that have been meeting that we've been participating in actively over the interim. There's the Universal Healthcare Work Group that Pam's a member of, that we support, and also the School-Based Health Center Work Group. Again, looking at this nexus of, how do we support, in a school-based environment, people accessing low-cost coverage and coverage options that are available to them. Okay. Too early for the holiday cup. Starbucks. Okay, on to our 2021 legislative priorities. We have several areas of focus here. First, based on sort of our experience with COVID and also our strategic priorities, and also where we've been sort of building over the past few years with the implementation of Cascade Care. So they all sort of culminate in a package that hangs together for this session. Focus on reaching the uninsured, focus on advancing health equity, focus on improving affordability, focus on improving and leveraging Health Plan Finder as one of the more modern platforms in the state that a lot of our state agency partners are working with us on how to best leverage for their programs and to support shared populations. And finally, our biennial budget request. So I'll sort of step through the policy priorities, and then Nick will step us through some additional budget details. This is all that I will say on budget, and it is what I say to all legislators who are interested and want to listen to me. First, when you hear us asking for increased resources, we're not asking for general fund state dollars. We're asking for increased appropriation authority. So no general fund state increases. I was going to put it in different size font and underline it, but you get the point. We understand the budget challenge the state's facing this year, and we also, as part of our request, included a 15% reduction in our general fund state dollars, which is the same request that was made of various state agencies and resulted in some pretty devastating cuts that I know that a lot of you all are working on and advocating for at the governor's office level and beyond. We also have no increase to the carrier assessment. This is important, particularly to our carrier stakeholders. We can sustain the requested expenditure authority through our existing revenues, and we don't see a need to increase the carrier assessment. I will say as a caveat that, we're very aware of the sort of volatile nature of the environment we're in, and of COVID, and of legislative decision making, and we're sort of hopeful and doing some advocacy to make sure that that can stay the case. I'll let Nick speak more to that. Balancing to available revenues, we balance to our budget, and finally, we are funded pretty substantially by federal Medicaid dollars because of the services we perform, the administrative services we perform on behalf of getting people enrolled in Medicaid, and that's something that we feel that we worked this year to take advantage of more fully. And so again, Nick will be speaking more to that. But take homes from my perspective, when you hear me on the next few slides say increased resources or increased requests to do X, Y, and Z, none of that is translating into general fund state dollars or carrier assessment dollars. Okay, so first, reaching the uninsured, advancing health equity. I mentioned there's obviously disproportionate impact in communities of color. We've done a lot of the partnering to try to reach out to community and help people get enrolled. particularly to the newly unemployed. We've identified sort of 3 areas of most immediate need that we put forward for this session. The first is a new business and worker outreach program. We simply aren't staffed to support the level of work that we've been doing over this interim, reaching out to small employers, large employers, the chambers of commerce, HR departments, and others to really make sure that there's a good nexus between people who are losing, and the rapid response teams, making sure there's a good nexus there and a solid handoff for people who are losing their jobs. This is something that a service we've been asked to provide. We would need to increase staff resources to make that happen. Second, year-round outreach. We saw and learned from our COVID experience that targeted outreach around some of these ongoing special enrollment periods makes a notable difference in a way that benefits new, younger, and minority populations. So we have a request to do more of that, particularly in this upcoming year, as sort of the pandemic continues, and also we're sort of reopening. What does that look like? We expect there to be continued volatility in our economy for at least the next 1 to 2 years, as is being forecasted by the state. Finally, we do need some enhanced data analytics to further understand and identify where the uninsured are coming from, who they are, how we can reach them more effectively. We do some customer surveys now to try to capture, particularly among people who drop their coverage with us. There's much more we could be doing in combination with our state agency partners to move the dial on and get a little bit more exact on how we're reaching people and how we're helping navigators and brokers find people that we want to be enrolling in coverage. Those are our budget. Those 3 that I just mentioned were budget request items. We're always asked both about our budgets and about our bills. From a bill perspective, one that some legislators are interested in that we're providing technical assistance on and reaching out to ESD about are sort of how could we get further access to ESD data to do some of this outreach. In statute, ESD can share data with state agencies. Because of our quasi-state status, we were told that was a barrier for us to receiving some of the same data directly. So that's something, sort of a technical fix bill we would look to support and help interested legislators move this session. Second big area of focus, affordability. Obviously, this is something we're working at from a couple of different languages, couple different areas. First, from a budget perspective, you'll see a decision package from us to increase our sponsorship program capacity. This is to help the public and the private payers come forward and provide more immediate premium or cost sharing assistance to people. This is something that could stand up and work immediately as we're working to stand up a broader state subsidy program. So we see a good opportunity there to move that work forward in concert with the governor's office and others. We also see opportunity to pilot this with certain subpopulations or target it to certain groups to the extent that's of interest to various stakeholders, legislators, governor's office, etc. From a bill perspective, there are 2 areas where there seems to be legislative interest moving into this session. First is continuing to address affordability through improvements to cascade care. So again, the Representative Cody and Senator Frock were the main sponsors of that cascade care legislation, continuing to work with them on areas that are of interest to them, looking at statewide coverage, looking at bringing the premiums of those products down further, thinking through as a state what the next step is there in terms of cascade care implementation, knowing that whatever we would pass this session, we're already looking a few years down the line because of the timing for carriers to file their products. So, taking action this session is translating into 2023, 2024 changes, which is why I think there's some urgency from a legislative perspective to keep looking at this rather than waiting, which would just sort of move the ball further down. We're also required as part of the state implementation plan or the subsidy study I mentioned to submit draft bill language. We don't know that's language anyone's going to pick up and run with, but you'll see that from us later this week. Finally, with regard to improving and leveraging Health Plan Finder, we work pretty actively as part of an IT coalition that has DCYF, DOH, DSHS, and HCA as sort of partners looking at how we can best leverage state resources across our various platforms. part of what has been identified as a need is improving sort of the long-term capability of Health Plan Finder, so there can be greater flexibility and ease to help the kind of new and highest need customers. So this is something that has come up in the context of the COVID response. I'll give an easy example, the federal stimulus package to provide the extra $600 a week bump in unemployment. We need a system that's able to implement those changes more readily than we were able to. We had to do a series of emergency fixes throughout the duration of a 1, 2, 3 month period to make that happen. There are some dependencies in our system that made it challenging for us to implement those changes to consumers more quickly. So we're looking at a sort of modular, we want to make our system more modular so we can more readily address those types of changes. We think both with the pandemic and with the federal transition at the presidential level that we are going to see a lot of regulatory things that got done and then have to get undone, or that changed and then will change back. We need an ability to kind of be flexible in how we're able to make these system changes so our customers aren't caught in the middle of some of these federal policy debates. And I also mentioned earlier that the security program resources, we've seen a terrifying increase there in terms of our cyber attacks. Okay, so I'm going to pause there. I'll look, Mary, to see if you've gotten any questions. And again, to people who have questions, you can email Mary at mary.mchale@wabiexchange.org. And apologies again that our Q&A feature isn't working this morning. I'll hand it over to Nick to speak to our budget in further detail, and then to the extent people have questions, we'll answer them. To the extent you want to just hear us talk amongst ourselves, we're happy to do that as well. But I'll turn it over to Nick, and then we'll come back to questions for the group. Appreciate everybody's interest. Nick, take it away.
Excellent. Of course, frog my throat immediately. Thanks, Joan. Hi, everybody. I don't think I've met most folks on here. My name is Nick Ostaby. I'm the Associate Director of Strategic Budget Planning. Moving on towards the actual biennial requests. I don't think I'm in control of the slides though, Joan. Can you advance me?
Oh, sure. I would love to.
Thank you. So starting off, big thing for us is the exchange is statutorily required to be self-sustaining. What that means is when we do receive a budget or expenditure authority, we do have to balance that with incoming revenues. At no time are we allowed to have a budget that exceeds our anticipated revenues. Revenues themselves are generated through two sources. One from a 2% premium tax, and that's based on plans sold on the exchange. And your second one is through a carrier assessment on health plans and dental plans, also through the exchange. Big note for this year's budget request is back in 2018, we had decreased our carrier assessment from 746 down to 336, 55% reduction. And a part of this package is we would be able to sustain that same 336 ongoing, pending any changes to our current environment. But based on current enrollment levels and premiums, we're able to take on this entire package with the existing carrier assessment. Our other two funds are a general fund federal dollars and then a general fund state. Those funds are given to us to help us service the Medicaid populations. And those really are a reimbursement of expenditures. And so when we don't spend them, that money just kind of goes back to unused funds. So we always try to make sure we're leveraging and maximizing all of our available federal funds, and this package definitely does. Just make sure those questions are for me. Excellent. The chart on this page, we can go back one, John. The funds on this page really to kind of show everyone how our spending has fluctuated from the inception of the exchange all the way through next biennium. What you'll see, starting with your blue charts, are really those implementation grants that really got the exchange up and running, in particular getting Health Plan Finder up and moving. Starting in 2015, we started getting a state appropriation as those grants started kind of winding down. And then going forward, we really have just our general fund federal dollars, our general fund state dollars, and our 17T, which is that health benefit exchange account funded through the premium tax and our care assessment. And the big thing you'll notice really is our spending really has leveled out, and really now looking on just kind of sustaining the exchange with minor fluctuations for kind of one-time projects or recognizing our level cost, we'll see an increase. Moving forward, if you would.
Nick, can you
Oh,
we got a question about the if you could explain a little bit more about how the carrier assessment works. There's some interest from audience in that.
is that question for how it is determined to be?
Yeah, I think a little bit more on who we assess and how the timing of that works would be great.
Absolutely. So working at the carrier assessment, given our statute kind of dictates, how that all comes to be. What we do is we take our existing expenditure authority or appropriation, and we back out first our federal dollars, our general fund state dollars, and the anticipated premium tax revenues. And then instead into carrier assessment, that's the final math equation that says, all right, if you still have that gap of, we'll say $8 million, then we take our existing weekly forecast and we project out the anticipated revenue that would be required to fill in that gap. And then we also apply a 3-month operating reserve on top of that that was added to our statute a couple of years ago. That carrier assessment is generally used to cover the qualified health plan share of our expenses. So typically the premium tax is used for matching the federal funds when there's not a general fund state to do it. And then as part of our cost allocation methodologies, there's also a QHP portion, as our QHP is currently about 10% of the Medicaid enrollment. Then typically 10% of all those shareable costs of Medicaid have a QHP specific share of the cost, and that is paid for with the carrier assessment. Or if we have any QHP specific activities, such as if we want to, increase sponsorships that would only benefit QHP populations, those kind of funds would be then used by the carrier assessment and also the premium tax as necessary.
Thanks, Nick. Super helpful. And yeah, as Nick mentioned, in our enabling statutes, there's a pretty prescriptive formula that requires us to, sort of spells out how the assessment works, and then Nick just spoke to sort of from a budget perspective how that's backed into the amount that gets determined. So appreciate the question. There was also a question about the availability of these slides. We'll be posting. We have a legislative priorities page on our corporate website, and we'll be posting these slides to that page. So those will be available from us once we clean up and update that site a little bit. So hopefully by later this week.
Thanks, Jen. This next slide, what it will show, and is kind of from that previous slide, you'll see kind of the leveled off purple bars. That is our current enacted budgets. The yellow highlighted one for 21, that just shows our current state fiscal year, just so you can kind of get an idea of where we are amongst this chart. And then as you're looking at the top right hand corner, that light blue colors, that is the total dollar amounts of our existing budget asks. So what you'll see is some one-time projects for 22 and 23, and then with an ongoing request of about $4.5 million per year, with the request being that those funds would be ongoing to support either increased costs for maintenance level, or as Joan mentioned, we had some ongoing requests of the policy level side to really support reaching the uninsured and continue to support businesses and for fire security side. Moving forward, Joan, thank you. So looking at our maintenance level packages, which is for a quick overcap, maintenance level packages are what we do when we are recognizing cost of what we did today is going up tomorrow. These are really just to make sure that we have the funding to continue to support the people that we do and the activities that we've been maintaining. And then policy over requests, or when you're really trying to add in new activities or new costs, or even expand what you had done previously. So looking at the maintenance level packages, we really have two for the biennium. The first one is our health plan finder. Our actual system costs for the maintenance and operations of it have increased beginning in this year. And so this just getting those funds increased, so we continue to support health plan finder in the way people are used to doing. The second one is actually recognizing that as the pandemic started and we had to respond to fluctuations in for COVID, as well as our larger build out forecast care, a good solid launch, we had to delay some of our activities into next biennium. And so the second one says, because we focused so heavily on making sure we had a good year during the pandemic for the system, had nice and stable, we wanted to push out activities. So this just gets that money kind of shifted into that new biennium so we can continue to prepare the system. These two packages combined really get us a new framework for this next slide of policy level decision packages. By getting those funded, we'll be able to really make sure that our data analytics and our sponsorships and our monetization efforts are really prepared for success of them. So this next slide is our policy level packages. The first three I'll talk about, Joan had mentioned previously, is really being tied to us helping to reach the uninsured and really make sure that we're able to reach folks and support the workers and employers. So the first one, the Business and Worker Outreach Program. This one is really taking what we've done during the pandemic to support the employers and workers who are really struggling to maintain insurances. And so it's going to have us working directly with those industries as well as other parts of commerce to really have a dedicated team at the exchange and an ongoing and supporting folks. What we recognize is this was a great thing for us to start during the pandemic, but it's an even better one for us to really maintain. Next one is plan your outreach. Right now, we always do a good push during the open enrollment months for marketing. This package is really focused on doing a year-round push, letting people know about the SEPs that are available, and making sure that we really are reminding people that we exist throughout the entire year. And so we're on Able's mind as they do have economic or family changes that they're going to need us. We don't know that we're there year-round. The third one is really enhancing our data analysis. And this one's going to help us inform our outreach for both the businesses, the workers, and our targeted outreach efforts that are going year-round. This one's going to let us to better organize our analytics, as well as allow us to bring in some of our other sources, whether from our call center or other systems that we have, so they can all be combined into just a more robust data analytics. Mary, do you want to add anything on those three?
No, I think you just about covered it.
Excellent. So our next one is really our sponsorship program. As Joe had mentioned, we really learned this year that there's been a big desire to kind of increase the amount of people and organizations that are using our sponsorship program. So part of that main level package from the previous slide was allowing us to make some system changes to make it a more robust sponsorship program there. And this package then creates the ongoing staffing request so we can continue to support more businesses, more organizations, and really support those third-party payments in a better way for folks. And the idea of this one is also to make it scalable for us. So as we do see increases in the use of sponsorships, we're able to bring this along with it and see increases, so we can continue to support it as it grows and not just be a one-time, we're here, we're done, call it a day. We really want this one to be scalable for the years coming as we continue to build that out. Looking at modernizing Health Plan Finder, this one is really our big IT project with the idea of it being done for the fiscal year 22 and 23. And this is the package where you saw that one 2-year spike on the previous slides. This has a couple benefits to it. You know, the first one is it gets us away from kind of a one singular vendor for supporting our platform, the organization. Instead, allows us to kind of break it up into multiple components and modernize it and modularize it. What that'll mean for our consumers is we'll actually be able to leverage the system for future state programs a whole lot easier and quicker and more efficiently, which will help us really evolve as changes either the legislative environment or also the IT coalition. As that adjusts, we'll have a system that's much more flexible and allow us to take those on easier. Next, the following one is really enhancing our security functionality. So we have a very nice, robust security program now, but as Jonah mentioned, we have definitely seen an increase in our overall cyber threats for the industry. And with this is additional resources to make sure that we really are staying on top of potential threats, making sure that we're as absolutely secure as possible. And then our last package is the general fund state reduction. So due to the pressures of the COVID on the state's revenues, all state agencies, including us, were required to submit a 15% general fund state reduction. What the exchange has done is we proposed that, but we're also requesting they backfill that general fund state with a increase in our Health Benefit Exchange account. That way we continue to serve the folks in the state that really need us right now without seeing any sort of deterioration in our services or our offerings. So then last, this package was all sent to our board back in August with unanimous support for our request And you can also find all of our decision packages in full on our corporate website at the following link, and that will be good and live as people get this package after the meeting.
Nick, thanks so much. Mary, I'm not sure if any questions came in specific to Nick, but we'll pause to take those and more generally move to if there are any other questions that people have. Again, we'll sort of be posting these slides, and we'll be pushing out to our external stakeholder listserv when our legislative priorities webpage has been updated, and that page will include a link to these slides. It will also include the link to our decision packages, and it will sort of note some, include my contact information and how people can follow up with me to the extent that they're interested in talking more about any of these proposals, how they may impact sort of groups of consumers that you work with and you serve. To the extent people want to discuss legislative strategy heading into session, would be more than happy to do that. We sort of right now are heads down driving toward that initial open enrollment deadline of December 15th. All of you lobbyists out there who rely on the exchange, and all of you who work with consumers who rely on the exchange, you got to come in and get your coverage by December 15th to have it go into effect January 1. So to the, there's sort of two prongs here. To the extent people want to talk about legislative priorities and legislative strategy, happy to do that. Also, we want everyone to stay safe and covered as we head into flu and potential sort of holiday season spikes. So definitely also feel free to reach out if anyone needs help enrolling or reviewing options, or if anyone works with a group of consumers who could benefit from us coming to talk with them about the new coverage options. We are more than happy to do that, or connect folks to navigators in their local area who can help people, particularly people who would want presentations in Spanish, or who may be facing other language barriers. We're happy to do that. And I'll pause there and just see, Mary, Nick, if there's anything else to add for the good of the order, if there are any other final questions we should address, and we'll sort of proceed from there. Evan, Nick, Mary, anything we missed?
I don't think there's anything that we missed. I'm not seeing any additional questions coming in. So thanks to the folks who did reach out to put those, I would say in the chat box, but instead in my inbox, so I can relay them to this meeting. But just going back to all of the assistance that is available throughout open enrollment, if you know of anybody in your network, any of your clients, any of your colleagues, just know that anybody stepping through their options certainly doesn't have to do that by themselves. We have a lot of assistance free of charge across the state, so let us know if you need help getting in touch.
Great. Thanks, Mary, and thank you so much to everyone who made the time to join us this morning. I know it's a Monday, I know it's a COVID Monday, and I know it's a COVID Monday before a week where we have a sort of federal holiday right in the middle of it. So really appreciate all of you turning out and joining. I hope this was useful, and to the extent that there are questions we didn't answer, you know how to find us. We'd be happy to have you follow up and set up time to discuss further. We'll go ahead and end there, but thanks, and I hope everyone has a great week, and looking forward to working with you as we head toward session. Have a good one.
Thank you.